Good afternoon. I'm here to tell you a story. A story about a regular old doctor who's been practicing medicine for 20 years, subspecialized pain management practice as an anesthesiologist, board certified. Every day, going through a grind, treating people with all of your heart, with all of your knowledge. 80% of the people do great. They go on with their lives. You get them back to where they need to be. And there's that 20% of the people there that never get better. They always need medicine. They always need treatments. And when they keep coming back, they don't seem to be healthier and healthier. And I'm treating them the best way that I could, or the best way that I was taught. So over 20 years of practicing medicine, a couple of things fit. And it made me decide, and a lot of other physicians like me, to start practicing regenerative medicine, understanding what stem cell medicine means, understanding what prolotherapy, what tensegrity means, what all the other manifestations of you mean to you, that you may not even realize that sitting behind your desk for 8 hours a day is actually killing you, shortening your lifespan, thinking that a glass of wine a night is healthy, thinking that I have cheat days on my diet and that doesn't really affect me. So as I start trying to teach people how to become healthier in order to live a less painful lifestyle, or a lifestyle less managed by their own pain, I found a large portion of people that I consider awake or aware. And this is what I decided to do. I decided to open up a practice that specializes in regenerative therapies, including stem cells, bone marrow aspirate, platelet-rich plasma, exosomal therapy, and all kinds of other, what you may consider alternative medicine, but what I consider the root of making somebody whole and balanced in order to live a healthy lifestyle to its fullest in many ways. Your relationship with your family is even important in this type of a lifestyle. In this day and age, we give our children cell phones that they eventually ask Google questions when they're going through their changes in teenage years. They'll ask Google before they'll ask their parents. I really see something wrong with that. And I really see a need for medicine to change back to the way it used to be when I was a child, when we respected our doctors because they knew above and beyond everything else, our health was the most important. Now, I gotta tell you a story because this stuff didn't just all happen in one day. I'm an anesthesiologist, and I took a subspecialty training in pain management. I also spent about 6 months in an open heart cardiovascular anesthesia surrounding doing pediatric and adults. And I'll tell you a story about one day that introduced me to regenerative medicine. This was around, I'll say 1999. And we were doing an open heart surgery, and it was on a 80-something-year-old gentleman that had multiple previous open heart surgeries. So here we are in the operating room, and the physician or surgical assistant comes in, and this person was a wonderfully talented surgeon. He dissected from the ankle all the way up to the groin the saphenous vein. He pulled it out beautifully. Wonderful specimen, put it on the back table, talked to the perfusionist for a minute, and they laid a blue towel, a dry blue towel over this blood vessel on the back table. Now, the saphenous vein is what the surgeons use because it's a long vein, and it's got sections of it where it doesn't have tributaries or roots coming off of it, and they can cut those pieces and use that like a hose to bypass an area in the heart where the blood vessel is blocked. Okay, so that's what's called coronary artery bypass surgery or an open heart surgery. They're basically a bypass of where there's a blockage, and they use a healthy vessel to bypass where there's the blockage. So all that aside, now the surgeon comes into the room, the cardiovascular surgeon, the heart surgeon. He dissects the skin over the sternum, and then he puts a saw on the chest, and he runs the saw up the chest to open up the chest cavity. When he does this, I have a monitor behind me, kind of like this, a little smaller at that time, and it was with an echocardiogram that goes down the person's throat, and it's right behind the heart. So every time the heart beats, I can see all 4 chambers. And as soon as that saw went through that guy's chest, his right atrium deflated, and I knew that there was an emergency. Everybody scrambled to get what they call femoral bypass, which is a shortcut to bypass that is not the most optimal situation. So during the emergency situation, stabilizing the individual, you also wanted to pack the brain with ice, and they finally got the person on a bypass. Everything was hunky-dory. As an anesthesiologist, when you're on bypass, it's a time to always pay attention, because you have to pay attention to everything in the room at all times, but it's a time when you can relax, because the perfusionist really controls ups and downs of the blood pressure. So, having a nice surgery, the surgeon actually ends up repairing the damage to the atrium, and it's about 6-8 hours later, he talks to his assistant and says, okay, get me the graft, let's do the bypass. So I lean over the curtain and I say, excuse me, sir, did I miss something? Did you get another blood vessel? That's been sitting out on the table for hours. It's not even under a wet towel, it's under a dry towel. And the surgeon looks at me and he goes, it was filled with PRP, it's fine. I had never heard that phrase before, PRP. He says, platelet-rich plasma. I go, what's that? He says, ask the perfusionist. He obviously didn't have time, and this was way above my level at that point. So I went to the perfusionist who's running the machine, the bypass pump, and I said, what is PRP? And he explains to me, you just take regular whole blood. You spin it for a few minutes. And the red cells have iron in it, so they sink really down to the bottom. I suck off the stuff on the top that looks kind of like a cloudy yellow stuff, and that's filled with plasma and platelets and all kinds of growth factors and things. And I concentrate that, and when I concentrate that supernate solution, the yellow cloudy solution, 8 more times, your white cells start to spit out growth factor and actually create an environment where they think they're walking into a fresh trauma and it's in a test tube. So I use that solution to inject it into the blood vessel, and it's almost like magic juice. And to this point in my career, it looked like magic juice to me. I had never seen anything that amazing that actually supported healthy tissues in a way that none of the synthetic materials do. So I started thinking to the surgeon, I actually commented to him, hey, a couple of weeks ago, you and I did a heart and lung transplant, and you guys were stressing out about the time that it took me to put the central lines and the catheters into the heart, because you said that the solution that the heart and lungs was in costs tens of thousands of dollars, and it only lasts for a couple of hours at a time. I said, why didn't we just pack the heart and lungs in platelet-rich plasma? And his comment was that I had a lot to learn about the business of medicine. So over time, I kind of realized that there's a certain business modality in medicine that people actually pay the doctor more money the further away he gets them from the end goal of fixing them. Because if he fixes them, the patients may not want to come in every month. Disease processes. First one that comes to mind, the simplest, easiest one, is diabetes. It's treated all wrong. It's a horrible disease. But diabetes type 2 is created because of behavior. And the mainstay of therapy is medications treating the blood and not the behavior. And I just don't understand that. So as I'm practicing medicine and I'm seeing people who come to me, and I'm a board certified pain specialist, they're coming to me and they're asking me, how do I do this? How do I do this without pain? I tell them, well, it's a long process, just kind of like how I trained my brain to become a doctor. I couldn't just do it in one day, and there wasn't a pill for me to take it. It was a psychological training. It was a physical training. and it was a stress level training. You've got to be able to manage these things in your life. And throughout my career, I found out that I've never actually fixed somebody with a pill, but I fixed somebody with advice hundreds and thousands of times. And my advice is always to be as healthy as you possibly can, and to start with what you like to do, and to move forward with what you're capable of doing and add to it. So, if you're a high school athlete, at 40 years old, you may not want to go back to the gym with the same intensity you had when you were 16 years old. So you got to start out slow, and you got to start out doing things that don't hurt you. You've got to start out doing things that are fun. And this is where the practice of medicine actually starts. It actually starts with children. We should take whoever created that food pyramid and take them out back behind the parking lot and kick their butt. Because bread is not a major category of something that people need to eat on a daily basis, neither is meat. You'll find these things out later, because I am not going to introduce to you my dietary suggestions, because I've also found in the 20 years of practicing medicine, it's easier for me to convert you to Greek Orthodoxism than it is for me to actually get you to change your diet or to stop going to one of the fast food restaurants that you're in love with. So let's fast forward about 5 years into practice from the story of residency. And we have a board-certified pain management doctor doing injections, writing prescriptions, making people stronger, better. And he's making about 85% of the people better, back to their normal lifestyles with single treatment. Narcotic prescriptions are low. He's very happy with himself. He's proud with what he's doing for the majority of everybody. But there's a nice chunk of the people that no matter what he does, they don't get better. They kind of get further away from that end goal of fixing them. The more therapy I give them, and it's the same therapy I give to everybody else, but people aren't all the same. Some people have different motivations. Some people have different abilities. Some people have different inner strengths. So, I'm doing injections one day, and a really wonderful neuroradiologist, brand new in town, came by the office just to come meet me. So he sat down, he sat in the back of my operating room, and he watched me do a couple of injections. He said, there's a doctor in town doing wound care therapy, and he's using these regenerative stem cells that are from the inside of these people's bodies, from their blood. I went, wait a minute, so it's not stem cells from some abortion in some other country somewhere, or something that nobody has, it's from the individual. What are the dangers of that? I don't think there are any dangers. It's your blood. How can your blood be dangerous to you? Okay, what are you doing? And he described to me the creation of platelet-rich plasma for wound care. And I started to think, why aren't I doing this in the spine? Why aren't I injecting platelet-rich plasma in the spine? So I looked in the literature, and I even knew from my training that 50 years ago, a procedure was described called a blood patch. And if you do a spinal injection and you poke your needle through the dura bag that holds the fluid around your spinal cord and your spinal nerves, the younger you are from 65 years old, the more likely you are to have a terrible headache. So we just take whole blood out of the arm and inject about 18 cc's into the epidural canal, and the headache goes away, surprisingly. Now, recently, studies have shown that you're not really closing the hole, and nobody can explain why the headaches go away. So the procedure kind of came out of vogue. But something made me remember a study of a guy that did whole blood injections in the spine for people who were over 65 that had chronic headaches. And he had a significant success rate. But that study died with the individual doctor because there really wasn't a business model behind it to make anybody wealthy. It was only set up to fix people, which is why we practice medicine. So, now you know how I feel. And I started thinking, how can I do this to my patients? So I started talking to people about it. Hey, I've done 4 or 5 injections on you with steroid, and you keep coming back to the same goal after a couple of months. You're doing mainly the right things that I want. I'm happy with you as a patient. Would you try something if I introduced it? Well, patients started asking me more questions about it. And one of them was eventually brave enough to try it. And together, we made a hell of a difference. I started doing this in the majority of my practice. And I started making a big difference in those people that I would normally send for surgery. Instead, they would get 1 or 2 injections a year, and they could reduce their narcotic use. So then this brings me to another story. Right around that time, I had a wonderful person in my life, who was one of my best friends. She used to go running with me. She used to go to the gym with me. She was my office manager. And she had a really, really, really difficult time with some arthritis pains that were relieved doing a couple of injections a year and staying strict with her exercise regimen and her diet. And at one point in time, she kind of stopped exercising with me, and I didn't really think too much of it. It might have been because her husband may have said something and she may have felt funny, and we were friends, but I didn't think anything of it until I saw her walking in the office one day like a 90-year-old lady, and here's a woman in her 30s. And she coughed in her hand and she coughed up blood. And I said, what's going on? And she described to me she was on one of the disease-modifying anti-rheumatoid drugs that a golf professional talks about on TV. And when he's showing his wonderful golf swing and all the happy people in the background, there's a voice in the background that says you can get tuberculosis, you can get strange cancers, you can get all kinds of things that I personally believe that pharmaceutical companies shouldn't be allowed to advertise to the patients because of hype. Because everybody wants to be a golf pro that looks good, and they don't listen to the disclaimer on the bottom that they could have a horrible process that ends their life. So, she went to the emergency room, thought she had tuberculosis, coughing up blood. I thought we all eventually were going to contract it because it takes very little to spread that disease. And after a month in isolation, she went from 130 pounds to 80-something pounds, and they did an open lung biopsy and found out that it was a reaction from the drug she was taking for her arthritis. And they gave her an oxygen tank and a 2-month expiration date. Do the best you can. So, I didn't want to take that. And I decided, let me take her out back to the surgery center. I hooked her up to an asthma nebulizer. I talked to her husband and her about giving her a breathing treatment with the PRP. At first, I wanted to stick a fiber optic bronchoscope in there, but I imagined brittle blood and brittle tissues and having more of a problem with her, with the blood I had introduced from the procedure than the actual treatment I was giving her. But after the therapy, she had a significant improvement. And I realized I was on to something. So I patented a device for nebulization of stem cells, for nebulization of platelet-rich plasma, and for nebulization of a multitude of other regenerative processes, as well as organic oils. So, from the point in time when I originally started to play with regenerative therapies, what I call autologous stem cells from platelet-rich plasma or bone marrow aspirate, I started to have a hard time balancing 2 types of patients. Those that wanted everything taken care of by their insurance company, and those that wanted to be healthy, no matter what. So I started looking at the insurance model, started to realize that if I give people a treatment modality or a diagnosis, they walk in limping, and I say, oh, 20 plus years experience doing this, you have a herniated disc, it's pinching L5 going down to your leg, you probably have a hard time going up on your heel, like up on your toes like that. I know what's going on. Let's bring you into the room, we'll do an injection, I'll teach you some exercises, get you physical therapy. Any of those modalities can actually make a difference. And usually I start off with the lower end modalities, and if they can't progress through therapy or they can't progress through an exercise regimen at the gym, 3 weeks later, I schedule them for an injection. Well, if I want to get this taken care of by an insurance company, I'm going to have to give you an x-ray. I don't need an x-ray. I only need an x-ray if I actually think you got a broken bone, maybe you got some cancer, something obscure. But they're not having any other signs of any other disease processes that I would have noticed. Why do I want to give you extra radiation? We know radiation isn't good for you. All right, now I get the x-ray, you've got the issue, I want to send you for an MRI, it's got to go to a review board from another doctor somewhere else. It's probably a gynecologist telling me that my judgment in why you need an MRI is wrong. So over that period of months it takes me to get to the point where I deduced it in 30 seconds of meeting you, most of the people don't follow through with the therapy. And they end up asking for a pill. And the pill helps. So does a bottle of Jack Daniels, whiskey, any other alcoholic spirits. People laugh. I go, you want a pain pill? There's a bottle of spirits. Same thing. Gamma aminobutyric receptor in your brain, benzodiazepines, alcohol, narcotics. Some of them hit NMDA receptors. All right, so you become dependent on something and you're in freaking cloud 9 and you're not even engaging with your family, your friends, your social environment. I've given you pills to make you into a different person, a flat affected zombie. And your kids are affected by it and your spouse is affected by it and you're avoiding your problem. 100 years ago, somebody had a pinched nerve, they sucked it up. They modified their behavior. They didn't walk to a doctor crying for an OxyContin, did they? What they did was they learned how to tolerate things, and your body actually modifies itself in its behavior to help you get stronger. You ever hear the phrase, what doesn't kill you makes you stronger? That's true if you have the right person to guide you out of that injury period. That's what I do. So about a year ago, I had a back injury, and it took me out, and I needed some surgery. When I came back from surgery, I had about 75% weakness in my left leg, and I'm a runner, and it devastated me, and it devastated my dogs who run with me. I decided to sell my practice and go into early retirement and take care of myself, because I listened to my advice. And after about 6 months, I started doing a stair stepper. And I really hated it because I had to limp and I had to hold myself up. And I had to train myself not to wobble when I was doing the stepper. I went from the stepper to the elliptical. Then I went to the elliptical to the treadmill, but I went too quickly, so I had to go back to the elliptical. I tried hiking a couple times. One time I fell up in the mountains in a spot where it wasn't good. So I decided I'm retiring and I'm going to take care of myself. And I actually gave myself a treatment using what I call stem cell juice. Now there's a wide variety of stem cell type products and regenerative products, and I'll explain those in later videos. But I chose to use an exosomal therapy from an amniotic based fluid. It's an ambient temperature solution. I gave myself an injection in the back. Simple injection. Not too sophisticated of a treatment. I do it to myself. About 2 weeks later, I started getting the strength back in my leg. And I started jogging again. Not great, but I'm back, and I'm gonna get back. And at that point, my friends and family said to me, "You're miserable. You're not fixing people." I go, no, I'm fixing myself. I'm happy, myself, my family, No, I wasn't. What I love to do, what I've done for the last 20 plus years, is take care of people. And now I'm at a point where I only have to take care of people that want my advice, people that actually are enlightened, people that actually believe that Their health care is their problem, not mine. I'm here to show you a solution. It's kind of like raising kids. They get bad grades, they're not your grades, they're your kids. I'm here to show you, kids and patients, how to live your life the way I live, how to fight your disease the way I fight my disease. You may not agree with it, and that's fine. That's why we live in America, and you don't have to listen to me. But if you choose to, I don't give up. And we make a lot of successful stories out of this clinic. So, welcome to the nice clinic, the Nevada Intercellular Exchange. Hope I see you soon.